So I am here to talk about the benefits of telehealth with OT. So at the beginning of the pandemic, we had to pretty much completely switch our patients over to telehealth, and it was extremely beneficial for patients for several reasons. Obviously, they couldn't be here in person, which is always, the gold standard. But for patients that were being seen over the screen, there were several reasons why it was great. The first one was kind of the biggest thing is that we can still educate our patients over the screen. So it's super beneficial for being able to educate them on their diagnosis, on their home exercise program, on just any questions that they might have regarding what's going on with them. And then also, just because you have that visual component, I can see how my patients are doing with their exercises. So I can actually look at them and see what they're doing, see if they're doing something wrong. I can easily change their technique. I can easily make modifications to it, so I can see exactly what they're doing and they can show me. And then the opposite is true. I can show the patient over the screen what I want them to do. I can show them the correct technique with my hands. So even though I can't get my hands on them specifically, I can show them what I wanted to do. Make any observations about how they're moving around. I can kind of see them in their environment. Sometimes it's actually really nice to be able to see a patient in their home environment. So if there's something they have trouble doing, many times I've said, okay, well, I'm sure go show me how you do that, and I can see if there's a way I can modify it. Especially with like an arthritis patient, they can say, oh, here's something heavy that I have trouble grabbing, and I can show them how to modify grabbing that item or how to do that in a different way. And then the last thing, which was sort of surprising to even me, was that I can actually take pretty accurate measurements of a patient's hand or finger over the screen. So if I hold a goniometer up to the screen, I am actually able to use it in a pretty accurate way. I'm not sure if there's been official studies on this or anything, but I know it is pretty accurate because I've compared it to like if the patient comes in and how their measurements are in that setting. So I can hold it up to the screen and I can actually track how they are doing, and I can document that. I always document that I'm doing it on a screen just for continuity purposes, but it's a pretty good way of measuring their progress.
Telehealth has been a really great addition to the outpatient therapy world, specifically hand therapy in our clinic. Early on, we used it when things were very uncertain. No one really knew what was going on with masking, distancing, how COVID was spread, who would get it, and so for people who were fearful, those who were immunocompromised or older adults, we used telehealth to continue care that had already started before COVID started, or before we knew what COVID was. And then since then, we've transitioned to use it a little more sparingly, but it's still, I think, extremely important and needs to be a part of outpatient care. Those who have physical disabilities, some mental illness, limitations with transportation, financial limitations, and just time constraints and work that doesn't allow for them to step out of the office during normal therapy hours. We use telehealth to reach these people who may otherwise just not do therapy. So is there a time and place for it? Yes, but I think if the trade-off is not having any therapy versus doing telehealth, I would pick telehealth any day. It's especially great for check-ins. So if we see someone for an in-person evaluation, but they might not need to come to the clinic, we can monitor their progress and update their home exercise program and check on, most things you can evaluate over video, like range of motion, various functional tasks. So we use it for that.
Hi everyone, this is Matt. So we work with clients with severe and persistent mental illness. They come to the program a couple hours in the afternoon and then go home around 12:30. However, due to the pandemic, we have switched to telehealth services and have started incorporating small on-site groups for members to come in and get the supports that they need. Telehealth services are offered here 5 days a week. We do 1 to 2 groups per day, hour to hour and a half groups, and the groups are led by rehabilitation counselors as well as other staff such as myself. I'm the occupational therapist on staff. I've been practicing for 5 years and working in psychiatry. Telehealth is such an important part of our clients' day-to-day services. It just really does provide a sense of community and support so they can get the skills and the help that they need. I've had clients tell me that it's a safe haven for them, just as the program was when we were open at 100% capacity. So telehealth services really provide a lot of additional support outside of the clients talking to their counselor on the phone, because they can see each other, they can hear each other, they can support each other. And honestly, whether the group is anger management or coping skills or social support or an activity group, because it is virtual and because that's our main source of communicating these days in the pandemic, the overarching premise of the group is supporting one another and helping each other to navigate life. So I really think that it's a godsend for a lot of our members and our clients here. A few scares in the state of Maryland not allowing us to continue telehealth services, and we've gotten a few extensions, but it is eventually, unless we get a petition or another extension, it is going to eventually transition out of telehealth services, I believe, and more into in-person.
COVID times, we couldn't be there in person, so it was either they didn't get therapy or we did a telehealth, okay? So the parents were there with us on the other side of the screen with their kids. They were learning throughout the whole session. We had a lot of kids closing their screens on us. That was interesting, but the bottom line is they received services, and we were helping them adapt to the virtual environment, which was their school environment. We were helping the parents, acclimate their kids to being on the computer all day, even just doing school in the house, but we were even able to work on toileting schedules at the house, stuff like that. Another experience I have is at skilled nursing right now. We're having huge job shortages. We just don't have the people. So we've been out of a PT for 3 months now. So when we can't get a part-time PT in, some of my patients will come in. They'll come in med A, so they're skilled, straight from the hospital, and they need PT and OT. And a lot of my patients are co-treats. So 2 weeks ago, we couldn't get a PT all week. It was ridiculous. So I did a telehealth co-treat with a PT where she was on the computer screen, and I did my eval, and then I facilitated her eval. She was dictating the whole thing, and I was kind of just positioning the computer, stuff like that. So by us doing a telehealth co-treat, my patient was able to receive at least 3 sessions before we could get a PT in. So pretty vital when you have to close the gap to lack of services. So that co-treat I did was pretty cool.
I have a lot to say about telehealth. So I first experienced telehealth when I was a level 2 student at Kennedy Krieger at the International Center for Spinal Cord Injuries. So I definitely do think telehealth is obviously very beneficial. There's so many pros to it. It's really nice to be able to really see the home environment, because in person, yeah, of course you ask about it, but going into someone's home and actually kind of seeing the setup and seeing how far they have to walk, or the different setup of their rooms, that's very, very beneficial. So I love that you're able to kind of get a view of their home setup. You're able to kind of see what's going on there. And also I love that, especially if you're working with peds, mom and dad are there and able to help out. So they're really more hands-on instead of in the clinic where the OT may be doing the most and then the parent may be just kind of sitting watching. This way you're really kind of educating the parent and helping the parent understand how to handle that child. So I definitely think it's great for people that aren't able to make it into the clinic, we can definitely still help them. I mean, they still have OT needs.
So as of now, we're still going strong with telehealth. It's very popular. People have gotten a lot of support and are glad they've joined. In the process, a lot of people have also enhanced their technical skills and learn how to navigate their phone or their laptop or their tablet through using telehealth services.
I think that it should continue to be a part of our practice. Even if it's not a huge part of our practice, I think it should be an option for people and really increases access to care for many who otherwise would slip through the cracks.